name's Whitney Rosenblatt, and I am the clinical team lead and the individual therapist for the AEGIS First Episode Psychosis Clinic. I'm going to talk to you today a little bit about our program and things that might be of interest for you when you're first exploring services for yourself or a loved one experiencing psychosis. So, what is psychosis? Psychosis is just a set of symptoms. It's not actually a diagnosis. And psychosis is the experience of losing some level of contact with reality. It can cause changes in your emotional, mental, and behavioral health, and can look like seeing or hearing things that maybe other people don't hear or see, having odd or unusual beliefs, and feeling really strongly about those beliefs, even if there's evidence that it's not true, and also feeling fearful or paranoid in situations where you typically have felt safe. So a common question is, what are the first signs and symptoms of psychosis? Many times they look like the development of other mental health disorders, things like social withdrawal, losing the ability to interact with people, losing interest in things you normally enjoy, depression, anxiety, not doing well at work or school, and sometimes starting to feel fearful or suspicious of others. More true signs of psychosis are things like hallucinations, seeing, hearing, or perceiving things that others don't. It also includes delusions or ideas of reference, which are fixed beliefs, even if there's evidence that that belief isn't true. And also paranoia or extreme fearfulness, again, of things that you may have normally felt very safe and comfortable around. Other symptoms may include things like disorganized speech or disorganized thinking, strange or odd behaviors that you or your loved one normally don't see or experience, and the inability to function in your day-to-day life, whatever that looked like before these symptoms began. So what causes psychosis? And that's a complicated question, but essentially many things can, and it's usually a lot of factors coming together. Genetics play a large role in whether or not someone may experience psychosis. But other factors can include trauma, especially young childhood trauma or long-term traumas. It can be daily stressors, especially if it's stacking up. It can also include substance use. And then it can include things like biological factors, medical history, medications that you may be taking, or the existence of other mental health disorders that you're experiencing. Psychosis can be caused by so many things. When people first experience it, it might even be hard to know what is causing the symptoms. So what makes psychosis different from schizophrenia or other mental health disorders? Like I said before, psychosis is simply a set of symptoms, and it can actually be caused by any number of underlying mental health conditions. It can be caused by worsening depression, PTSD, bipolar disorder. It can be caused by substance use disorders. And the difference is for schizophrenia, which is the thing we think of most often when it comes to psychosis, is that's typically a longer term multiple episode experience where the prominent symptoms are in fact psychosis, but impacts most, if not all, areas of somebody's life. A lot of people wonder what can trigger psychosis and if stress, trauma, and substance use can trigger it. And in fact, yes, it can. Again, it's typically a combination of these things altogether, but high levels of stress in acute moments of your life absolutely can cause it. Huge traumatic events in your life, whether it's from childhood, adolescence, or even recent traumas, can cause psychosis. And substance use definitely plays a part or can trigger psychotic episodes. So many people ask, can you recover from psychosis? And that's a question we get really often here at our clinic and any other clinic that supports first episode psychosis? And again, the answer is a little complicated because there's so many factors that come into play with these symptoms and these experiences. But most people can and do successfully recover. Recovery will look different for every single person. It may look like getting rid of these symptoms completely. It may look like living with these symptoms and being able to cope with them and still manage your day-to-day life. But no matter what your personal experience is with psychosis, most people can absolutely recover and live fulfilling lives, doing things that are meaningful, having community around them, and having the proper support to make sure that they're thriving. So in first episode psychosis, we get the question quite often, why is early intervention important? What makes the difference? And the reality is the sooner we can start treating these symptoms, the more likely someone will be able to make a long-term recovery, meaning those symptoms either go away or they're well managed with medication. Research shows that these symptoms should be treated within the first 3 years after an initial episode of these symptoms, and the likelihood that someone will be able to recover well really is implicated in getting support within those first 3 years. So what kind of treatment is available for people with first episode psychosis? Typically, we like to see a coordinated wraparound approach to helping people reduce or get rid of these symptoms and return to a helpful level of functioning. And that can include things like medication management, individual therapy, family therapy, peer support, and supported work and education. And for those of you who don't know, peer support is a huge part of these programs. And peers are people with lived experience who have recovered and are thriving and living with mental health disorders. And so it's really important to receive peer support because many of our clients initially feel alone and unsure of whether or not they'll be able to live good lives. And peers demonstrate that every single day. So it's an important aspect of our program. So it's really common when family members first come to us seeking support. They have a big question of, how do I support my loved one if they don't want any kind of treatment? It's a common experience for many parents, caregivers, and loved ones of people experiencing these symptoms. The most important thing is meet them where they're at, support them at whatever journey they are in this moment, and allow for them to make autonomous decisions about what feels best for them. The most important thing is being there, supporting them, letting them know there is help when they're ready, and trying to support them to the best of your ability while also taking care of yourself with things like family, peer groups, individual therapy, or anything else that helps keep you well while your loved one might be struggling. So what are the first steps to get connected to services? Help is going to be there, and there's a lot of resources you can utilize to try and connect to supports and services. The first one is the EPI-NC network in North Carolina, or the Early Psychosis Intervention Networks of North Carolina. If you visit their website, they can tell you the clinics that are closest to you and where you could receive assessments and connections to these types of programs. You can also do a quick Google search and see what supports and services are in your area. You can reach out to your insurance companies and find out what programs exist and what is within network if you have private insurance. And you can always talk to a primary care physician or a mental health worker or a peer support specialist, and they can connect you to the right services to make sure that you are getting the support that you need.